Hey, I'm Ryan. I'm a physical therapist here at Poplar Bluff Rehab, and I'm going to talk to you about the gastrocnemius, and more specifically about what happens when the gastrocnemius is too tight. The gastrocnemius is a muscle that originates off of the posterior aspect of the knee on the medial and lateral femoral condyles. It runs all the way down and blends in with the soleus to form the Achilles tendon that attaches on your heel. When the gastrocnemius is too tight, leads to lots of problems. I actually call it the root of all evil when it comes to musculoskeletal pathology from the waist down. It's going to contribute to low back pain, hip pain, knee pain, foot pain. There's all kinds of things that this muscle, all kinds of problems it causes when it's too tight. So a way to identify if the gastroc is too tight is you're going to have a patient go ahead and sit up in this position, straighten the leg out, and if you're going to ask them to, with their trunk fully erect and their knee straight, you're going to ask them to pull their ankle backwards. And if they have a tight gastroc, tend to what you see is a little flexion in the knee. So what you want to do is to go ahead and push down on the knee. And what you're going to look for is for this angle right here to be above 90 degrees by 10, so a 100-degree angle. And as you can see right here on this person, she's not quite able to reach 90 degrees. She's actually about 10 degrees off, and I can show you here with this goniometer. And if the knee is straight, go ahead and pull that ankle back as far as you can go. And we're looking at right about we're looking at 85 degrees, so which is 5 degrees off of 90. And what you want is 100. So she's got 15 degrees lack of dorsiflexion in the ankle. When the knee is extended, that's identification of a tight gastrocnemius. So this gastrocnemius can be treated many different ways, but a couple stretches that are good for the gastrocnemius are as follows. Go ahead and assume a position like she is, sitting up tall, knee straight. What you do is you grab a stretching device, which is right over here. Wrap a belt, stretching device, wrap the end of it around the forefoot, grab the device, sit up tall, knee straight, ankle pulled back, and actually kind of lean into it, and you'll feel a major stretch going back behind the knee, down the back of the leg. And I like to hold this one for a really long time, about 2 minutes. Make sure you're breathing in through your nose, out through your mouth, releasing the tension. Do it a couple times, multiple times a day, and that'll get you a really good flexible gastrocnemius after doing that for a while. Another stretch, go ahead and stand up for me. So go ahead and approach the wall here. Put both hands on the wall. We're going to stretch the left gastrocnemius, so I want you to put it behind you. And I want this knee to be forward with it flexed. Put this behind you a little bit farther. Keep the toes pointed forward, and then push out into the wall, chest out, and you should feel a major stretch going down the back of the leg right here. And then hold it for a good minute or two. Do it a couple times, several times a day to get that gastrocnemius loosened up. All right, so hopefully you know a little bit more about the gastrocnemius and how to identify if it's too tight. It does contribute to a lot of problems from the back all the way down to the foot. If you'd like us to identify if you have a tight gastrocnemius, give us a call, reach out to us on Facebook, or have your physician write an order for physical therapy, and we can address your tight gastroc needs.